Doesn't have evaluations for students. Hello everyone. Today we continue our presentation. And is Darby coming? Or who is going to help us with the timing? Okay. So look at Christina for the timing. Okay. I will remind you, you have 15 minutes for the presentation, and Christina will remind you when you have 5 minutes and then 1 minute left. Okay? So today we have two groups of presentations. The first group is following professional publication framework. There will be 3 presenters, then we will have a short break. And we will continue with 4 proposals, different type of proposals, either community research grant proposal or just research grant proposal. So the first speaker for today is Anushna Takanyan. I will not introduce her topic as she will do that.
Hello everyone, it's a big honor to stay today here, and I'm going to present my thesis topic, which is determinants of iron deficiency anemia among hospitalized children aged 6 to 59 months in Armenia. This is a case control study. So let's start with the definition. According to World Health Organization's definition, anemia is a condition in which the number of red blood cells or their oxygen carrying capacity is insufficient to meet physiologic needs, which vary by age, sex, altitude, smoking, and pregnancy status. In public health terms, it refers to low hemoglobin level. And iron deficiency is another condition which refers to the reduction of iron stores that precedes overt iron deficiency anemia or stays without progression. Iron deficiency anemia, finally, refers to the condition when iron stores are not enough to produce required level of hemoglobin. In this picture, we see the molecule of hemoglobin in the left, and the blue circle is a heme and the rest is globin. We see that the iron, which is ferrum, plays a crucial role in the structure of hemoglobin, and it means that if there is no iron, there is no hemoglobin. According to World Health Organization's 2010 data, 32.9% of the global population, which is almost 2 billion people, suffered from anemia. And preschool children and pregnant women are the most vulnerable groups regarding anemia, and 47.4% of preschool children affected from anemia. Iron deficiency is the most widespread nutritional disorder worldwide, and it's mainly issue in low and middle income countries. In this chart, we see the causes of anemia, and the green one is the share of iron deficiency, and we see that almost 50% of anemia caused by iron deficiency. The next chart shows the global burden caused by anemia. This is burden. The disease burden for anemia is 68.3 million years live with disability, and for iron deficiency, the global burden is 19.7 million disability adjusted life years, which is 1.3% of global total deaths. Iron deficiency anemia caused 273,000 deaths worldwide, and 97% of those occur in low and middle income countries. Here we see the mechanism of anemia, and it's divided in three groups: genetic hemoglobin disorders, nutrition and infection diseases. We see that the iron deficiency is in nutrition block, and iron deficiency can result from inadequate iron intake and absorption, increased iron requirements during growth, or excessive iron losses. Different studies in different countries defined risk factors for anemia, childhood anemia specifically, such as low birth weight, younger age, male sex, family socioeconomic status and food insecurity, child malnutrition, low iron containing or iron inhibiting diet, blood loss, acute or chronic diseases, also early umbilical cord clamping, and maternal anemia during pregnancy. Anemia and iron deficiency anemia has consequences on child mental and physical development, such as impaired motor development, mild or moderate mental retardation, delayed maturation of central neural system, impaired linear growth, and also low tolerance to infections due to impaired immune system. Situation in Armenia. According to Armenian Demographic Health Survey in 2005, prevalence of anemia among children 6 to 59 months in Armenia is 37%, which we see has been increased during the time compared to 2000 data, which is where the prevalence is 24%. Prevalence of anemia in rural region of Armenia in Tallinn is 32.4% according to CHSR study, and there is no data about iron deficiency anemia in Armenia. And the last point stands as a rationale to conduct our study. Study aim is to identify the risk factors of iron deficiency anemia among hospitalized children aged 6 to 59 months old in Armenia. And our research questions are: what are the independent risk factors of iron deficient anemia among hospitalized children aged 6 to 59 months in Armenia? And the second, what are the barriers to access iron-rich food for families of identified population? To address our research question, we conduct case control study, and we have chosen three study settings: Arabgir Joint Medical Center, Muratsan University Hospital, which are two major pediatric hospitals in Yerevan city, and Hematology Center after Professor Yorlan, which is specialized clinic in hematology. We defined our study population, children 6 to 59 months of age, being hospitalized in mentioned hospitals during 1st January 2015 to 8th April 2016. And we had inclusion criteria for cases and controls. For cases, it's iron deficiency anemia status, which means hemoglobin level below 110 gram per liters in the blood, mean corpuscular volume less than 70 femtoliters, and serum ferritin, which is the iron source of our organism, less than 12 nanograms per milliliter. Controls had no anemia, hemoglobin level above 110 gram per liters, and mean corpuscular volume more than 70 femtoliters. Unfortunately, we couldn't get data for serum ferritin for controls because children usually check for serum ferritin when they already have anemia. Cases were selected from 3 hospitals, but controls we have chosen from RFD Medical Center because they provided a list of patients with their demographic and contact information, also with some clinical data. And we made a decision to took children from the pool of same clinical diagnosis in order to control for potential effect of disease on anemia status of the child. For case selection, we, from laboratory service data, we identified children with low serum ferritin level, and then we, in medical records, we checked for other inclusion criteria such as age, hemoglobin, or MCV. And for controls, we made a list of potential participants